President Uhuru Kenyatta is expected to address the nation on Monday on the way forward as regards the COVID-19 pandemic and control measures imposed to curb its spread.
The address will be preceded by a consultative meeting with governors, which is expected to inform how the head of state will make the tough choices before him. And as Victor Kiprop now tells us on the options, anything is possible, and that is going by the rapid surge of infections.
In his address to the nation on the 6th of July on reopening of the economy, President Uhuru Kenyatta sounded this warning.
The order to reopen is given conditionally. Should the situation deteriorate and pose a challenge to our health infrastructure, we will have to revert back to lockdown.
And so the president has convened an intergovernmental summit for Monday to review the response efforts, and with numbers surging to a record high of 960 in a single day, far-reaching measures are not too difficult to contemplate, with experts saying Kenya may have to draw lessons from the rest of the world.
If you look at Wuhan in China, they actually implemented a total lockdown. And, it worked. But now if you look at our country, you can only do that, in a country where you are able to support your people, like give them food, pay for their rent and everything.
But beyond the economic pains, the country's healthcare system is also increasingly being overwhelmed by the soaring infections, presenting a tough balancing act, as the technical team once observed.
What we are looking at here is a possibility of extending the interventions and thereby reducing the rate at which the number of new cases come. If you are able to extend this, then our healthcare system is not overwhelmed. Those that require critical care services are able to access that. Those that are able to access the critical care, when they access that, therefore you reduce the rate of mortality.
Also in the agenda of Monday's meeting is a review of county preparedness. Each devolved unit was to set up well-equipped isolation and treatment units with at least 300 beds. But only 26 counties have so far met the target, according to the Council of Governors.
How many counties in this country have enough beds to take care of this? And so the first focus for the president is to ensure that we strengthen these counties to be able to have enough bed capacity for people who are going to become sick.
Yet again, the near impossible choices lie before the head of state. An opinion is divided among Kenyans on which way to go.
Kama ugonjwa iko, afunge tu Kenya. Hakuna faida watu wakufe.
Fadhali afunge counties to stop the interaction of the people.
Hata akifunga ama afungue, bado hii ugonjwa tayari imeingia kila mahali.
Some countries and cities around the world have also had to reverse reopening plans in the face of a second wave of infections. Victor Kiprop, NTV.